So next we'll start with the hepatobiliary system. So under this we'll be dealing with initially the normal structure of the liver. Then we'll see about cirrhosis and the various causes causing it. Then we'll discuss the different causes of cirrhosis, that is alcoholic liver disease, non-alcoholic fatty liver disease, alpha-1 antitrypsin deficiency, Wilson's disease, hemochromatosis, viral hepatitis, autoimmune hepatitis, Ray's syndrome, primary biliary cholangitis, primary sclerosing cholangitis, and finally we'll see about the tumors of the liver and biliary tree. So let's start with the normal structure of the liver. So the normal structure of the liver, the functional unit of the liver is called as a hepatic lobule. And this hepatic lobule is hexagonal in shape as represented here. And in the center, you are going to have a central vein. And at the corners of each of this hexagon, we are going to have a portal tract. So portal tract is the one in which we have the bile duct, portal vein and hepatic artery. So the main blood supply is going to come from the portal tract. And then you see the hepatocytes which are arranged in the form of trabeculae. So in the form of trabeculae, they are arranged from the central vein to the portal tract. So in between these trabeculae of hepatocytes, we see hepatic sinusoids. Okay. So based on this distribution, we are going to classify the zones of the hepatic lobule. So the outermost zone, that is the zone which is near to the portal tract, is the one which is called as zone 1, which is very much near to the portal tract. So whatever toxins are being delivered from the hepatic arteries or the veins, so from here it can reach the portal zone 1 first. So zone 1 is the one which is more susceptible for any kind of toxic damage. While zone 3, which is the most nearest one to the central vein. So here it is going to be far away from the portal tract, right? So the blood supply is going to be far away also. So whenever there is an ischemia, this zone 3 is the one which will show necrosis first. So zone 3 is particularly prone to ischemic damage. Also, we saw in CVC of the liver, so congestive venous hepatomegaly of the liver in right heart failure, remember? So there we saw nutmeg liver. So this nutmeg liver was involving this zone 3 only, remember? So there it was causing hemorrhagic necrosis. So I'll tell about certain cells also. So if this is the hepatocytes, we see these trabeculae of hepatocytes, right? So in between these hepatocytes trabeculae, we are seeing the presence of sinusoids. So in the space between this hepatic sinusoids and the hepatocytes is the one we call as space of Deci. So in the space of Deci, we have certain specialized cells called as ito cells or stellate cells. So ito cells or stellate cells, they store vitamin A. Also, another important function of these ito cells is they are the ones which are responsible for causing the fibrosis which we see in cirrhosis. Okay, so cirrhosis is caused by the fibrosis initiated by these ito or stellate cells. And there is another type of cell called as oval cells, and these oval cells are present in the canals of herring. So canals of herring are the ones which are present in between two hepatocytes. So between two hepatocytes, there is going to be a small canal which is called as the canals of herring, which has this oval cells. So oval cells are nothing but stem cells of the liver. So post any damage, repair of the liver is done by the stem cells. Also, post transplantation, if you give only half of the liver can grow into an entire size, right? So that is because of the stem cells. And these stem cells in the liver are called as oval cells. Then thirdly, inside the sinusoids only, we have certain cells called as Kupffer cells. Kupffer cells are nothing but modified macrophages which we see in the liver.